Hey there, welcome to your full spinal assessment. Before we begin, are you all comfortable under there? Okay, perfect. Well, I'm going to begin by just having a brief examination of how everything is naturally sitting. But as I do, why don't you tell me a bit about what brought you in today? Is there something specific you'd like to have looked at, or just a brief overview today? Okay. Left shoulder's really been bugging you. Yeah, I can see that. Okay, we will definitely take a more in-depth look at that later. Okay, yeah. For sure we will give some extra attention to those, but we will be doing the entirety of the spine today just because everything there is so interconnected. Often, if you have an issue in one area, it might be caused or overcompensated by another one. So, we like to give a very holistic approach here. But for now, you can just relax. I'm going to be using very light pressure right now, so nothing to worry about for now. Do you have any history of scoliosis in your family that you know of? Okay, that's good. Perfect. Yeah, I can already feel a fair bit amount of tension in the left shoulder compared to the right. Is this a recent pain or has it grown over time? Okay. Okay, I'm going to start using a little bit more pressure now, so please let me know if anything at all is causing you any disturbances, because it should still be quite gentle, but sometimes some bits can be a little bit more tender in the back, so please let me know. Yeah, there does seem to be quite a big knot here. But that might actually be a good thing, because if it's muscular, we might be able to correct it. But get in there a little bit deeper before I can figure out what's causing it. You've got a little bit of curvature in your spine, nothing that alarming. What I'm going to do for now is massage up and down your spine, help the muscles relax a little bit, and then I'll reassess once they're letting go of everything. So just relax. Okay, does the pressure feel the same on the left to the right? Okay. Again, pressure feels the same to the left and the right. Perfect. And pressure feels the same to the left, to the right. Good. Pressure feels the same left to the right. Okay. Pressure feels the same left to the right. Perfect. And one more here. Pressure feels the same left to the right. Okay, good. There is still a little bit of curvature in your spine. It does seem to be releasing as I massage it, which is a good sign. So what I can do is try to give you a few chiropractic adjustments and then move on to your shoulders, and we'll come back to the spine and see how those are setting in. Would you like that today, or do you want to save that for another visit? Yeah? Okay. Well, let's start down at the bottom. Okay, as I do your adjustments, I'm going to count down from 3. As I count down from 3, I want you to slowly inhale, and then as I make the adjustment, I want you to exhale, let it all go. Okay? Okay. So, 3, 2, 1. Good. Good. Let it all go. Okay. This one's going to be a little bit bigger here. Let me just get that ready. Okay. 3, 2, 1. Good. Good. And this one should be pretty small. 3, 2, 1. Good. And last one for now. This one's going to be a little bit bigger again. Okay. 3, 2, 1. Good, good, good. Okay. Yeah, this feels a lot better already. Do you notice any difference in how your spine feels? Okay, a little bit less tension. That's good. Well, let's leave your spine and see how those adjustments take. Let's take a look at your shoulders. Do you spend much time sitting at a desk during the day, or being quite sedentary, or... Okay, no judgments, just trying to get a feel for what this tension might have come from. Yeah, it does feel like your left is overcompensating for something, which makes me think that you do spend a good amount of your time out of alignment, a problem that most people have nowadays. So I would suggest either getting some sort of little vest you can wear that helps you with your posture, or you can try just having little breaks throughout the day where you try to give attention to your posture. Or you can try something like yoga. Anything like that, but yeah, from how it feels, it is muscular, which, like I said, can be reversed in most cases. Yeah, tension is usually just your body telling you that it needs a little bit extra care in one area. Okay, I'm going to use a bit more pressure, so let me know if it's too much. Is that good? Okay, good. Yeah, I can see why this one's causing you a good amount of trouble there. Why don't you give me a couple of shoulder rolls or lift them up and let them back down again. Okay. See, it's already feeling a bit better. Just asking you for a little bit more attention, I suppose. Okay. Let's see how that compares with your right. I think what I'll do is, once we're finished up here, I'll give you a list of a couple very short exercises you can do during the day just to help release when the tension is particularly bad. One thing I actually find helpful is doing these exercises in the mirror. Yeah, just by seeing how uncentered different aspects are, it can help your mind kind of reorient how everything's supposed to be. Take a deep breath in for me. Let it go. Good. Okay. How's that feeling? Good. I'm glad it's a lot better for you. Let's leave that alone for now. Give it a second to rest. Let's see how your spine is. Okay. Yeah, the adjustments took pretty well. Makes me think that everything was just a little bit stiff. Yeah, again, just yoga would help with spinal flexion, or you can even just put some music on, sway around, anything to just gently move your spine around. Helps break up that tension before it gets too deep. Okay, well, let's move up to your neck. I think I might make some adjustments here, just looking at it. So again, breathe in when I'm counting down, and then breathe out. So 3, 2, 1. Good. And another one here. 3, 2, 1. Good. And one more little one. Just here. 3, 2, 1. Good. Good. Okay. Let's give another check to the shoulder. Yeah, this is much better already. So I think with just doing those few exercises every day, we'll get you back here in a couple of weeks, see how everything is. How does that sound? Okay, good. Okay. I'm going to gently go over your whole back again. Can you just let me know if anything's sticking out? Figuratively, not literally, I hope. But if anything still needs to be addressed. Where? Here? Okay, yeah. Is that a bit better? Okay, good. Okay, well, I think that is all the work we're going to do today. Don't want to overextend on the first day. I'm going to give you a brief massage just to wind all the muscles down. So just relax. You can close your eyes if you'd like. Okay, well, like I said, I'm already very happy with how much progress we've made today. I think for the most part it will just take a couple of little tweaks and you should see a really big improvement over time. So just stop in at the secretary after we're done. I'll have that list of exercises for your shoulder, along with a list of things you can try if you'd like to, but other than that, is 2 weeks good for you to check in with how you're doing, see how everything's shaping up? Okay, perfect. Well, thank you so much for coming in. Hope you're feeling a little bit less tense, and I'll see you next time. Bye.
Hey guys, I hope you enjoyed the video. This is a gentle reminder to take off your headphones or turn down the volume since there might be a loud ad soon. And if you enjoyed this video, you should definitely go like, comment, and subscribe. But thank you so much for joining me, and I'll see you next time.